9 o'clock, but without wasting any more time, we will start with our topic because they are also little lengthy, so they are going to take time. So we will start with these two topics, which we will discuss today is Leishmaniasis and Cystisercosis. So first of all, Leishmaniasis, it is a protozoan and it's a vector-borne disease caused by flagellated protozoan of genus Leishmania. Okay, so this was the definition. Now there are 4 types of Leishmaniasis. One is caused by Leishmania donovani or donovani, some people call, whatever you feel comfortable with, you can call them as Leishmaniasis donovani, which is the major culprit causing 90% cases of the Leishmaniasis. So the common English name for this disease is Kala Azar, or जैसे उर्दू से ये लिया हुआ है, Kala is black, Azar is musibat, or visceral, another common name for it is visceral Leishmaniasis. L is for Leishmaniasis. Then second one is Leishmania tropica, which is caused by the, also the common name is cutaneous Leishmaniasis, and it is more prevalent in Old World. Leishmania mexicana also causes cutaneous Leishmaniasis, but in US. And the fourth one is Leishmania brasiliensis, and it causes mucocutaneous Leishmaniasis. You can see there are 3 types of Leishmaniasis. One is visceral, another 2 types, they are cutaneous, but they belong to different areas geographically, but they are cutaneous Leishmaniasis. And the third one is mucocutaneous, and then we will shortly see what is the difference. So my first question to you, please be active and write down in your chat box that what do you understand? This is not in your course, just for the general information. What do you understand by Old World? Old World. Chat box. कोई बताएगा? What do you understand by Old World and New World? Anybody? मैं अभी तक देख रही हूँ. Okay, I'll tell you because you are taking longer time and I have to complete my topic also. So, Old World is the ancient world that was discovered since centuries and centuries ago. And it includes Asia, Europe, and Africa. These are known as Old World. Raised hand. Zareen, what's your question? Yes, Zareen, what is your question? I cannot see any question in your chat box. Yes?
अस्सलाम वालेकुम मैम, हमारा चैट डिसेबल्ड है तो इसलिए हम कुछ लिख नहीं सकते.
Chat disabled है. Okay,
Yes.
what we can do is that this was for interaction, so we will discuss these things in the. I'll ask
Assalamu alaikum, ma'am.
the moderator to unmute. बेटा अगर इस तरह से आप लोग क्वेश्चन करेंगे तो हम खत्म नहीं कर पाएंगे टॉपिक. Okay? So we'll go. I was telling you the world which was discovered centuries and centuries ago, or the ancient world, which comprise of Asia, Africa, and Europe. Okay. And when we say New World is US, which is North America, Central America, and South America. Okay. All the Americas, they were discovered after some time. So that is also known as world, and the old world, which was already been discovered. Okay, is that point clear to you? शारिक प्लीज अगर आप मतलब उसको ब्लॉकेज से हटा दें तो कुछ क्वेश्चन या हम इंटरेक्शन कर पाएंगे. ठीक है. नाउ there are certain terminologies which you will come across like time and again. Okay, so you should know these terminologies very well before going into the detail of the disease, or as far as parasitology is concerned. So one terminology is vector. What is a vector? A vector is an organism that acts as a host for a parasite. Most importantly, the vector transfers the parasite to the next host. Here, when we are calling a vector, which is a sandfly, and these sandflies are up to 600, they have got the species up to 600, okay? And vector can be a mosquito also, as it happens in the malarial parasite. And then there are reservoir hosts. Reservoir hosts, an animal or a species that is infected by a parasite and which serves as a source of infection for humans and other species. So these are two types of sandflies. Most commonly, in 90% of the cases, the fly is phlebotomous, and the another fly is Leishmania, and it depends upon different geographical distribution. Some places this is prevalent, and in other places this is more common. So history of Leishmaniasis. This disease was found like centuries ago. It was discovered, but it was not known what is the cause of the organism, what's the life cycle, until this year 1900. In 1900, it was discovered, and in 1903, this Leishman reported this disease in journal. It was reported in 1903. Sir William Leishman observed the parasite in splenic smear of a soldier who had died of dum-dum fever. This disease has got different names. You will see plenty of them, a bag full of them. Okay, dum-dum disease, Kala Azar, visceral Leishmaniasis. There are so many names. Why this was called dum-dum? Because it was first discovered at a place in Calcutta, India. Then Charles Donovan of Indian Medical Service independently found such bodies in other Kala Azar patients, and they are now known as Leishman-Donovan physician, I should say. They are called as Leishman-Donovan because the particular type of staining which is used to diagnose such cases is Leishman staining. Leishman is widely used in hematology. You will find that this staining is found. Okay, and because these were discovered by this Charles Donovan, so they are known as Leishman-Donovan bodies. So what are they? They are the amastigote form of the parasite. Amastigote form of the parasite. You can see by the macrophages, as seen in smears from patients, and are known as these bodies. The disease is widespread in tropical and subtropical areas. So anyone can tell me what is tropical and subtropical? These should be clear in your mind. Just for your knowledge, I'm telling you the equatorial region is known as tropical, and then towards north, if it is there are two lines. When on the north side, it is known as Cancer, and the line below, which is on the southern part, is Cancer of Capricorn. So these two lines, 10 degrees above and below those lines, the area is known as subtropical. And tropical is known, equatorial region which surrounds the earth is known as tropical region. Why it is important to understand, just for your knowledge, that it's very extremely hot because the sun rays usually they fall upon directly there, and there is extreme evaporation from that surface and extreme rain there. So there are so many forests there, and then this fly is there, sandfly, and this causes disease. Okay, subtropical areas are found in 98 countries in Europe, Africa, Asia, and America. Okay. However, over 90% of the new cases occur in just 13 countries, like Afghanistan, Nigeria, Bangladesh, Bolivia, Sudan, Syria, and all these. If you're interested that how this distribution is there in the world, you can go to this. You can take the screenshot and go to this paper, and you can have the details. Pakistan is endemic for cutaneous and visceral leishmaniasis. It is common in majority is common in Balochistan, and then areas adjacent to Balochistan of Sindh and Punjab, most commonly in around the Multan area. Okay. Geographical, 350 million people live in these areas. Most affected countries are tropic, subtropic. The settings in which leishmaniasis is found range from rainforests in Central and South America to deserts in West Africa. More than 90% of the world cases of visceral leishmaniasis are India, Bangladesh, Nepal, Sudan, and so on. Etiology, as we have discussed earlier, that there are 4 type of organisms are there. Leishmania donovani, they cause visceral leishmaniasis. Tropica and mexicana cause cutaneous mucocutaneous leishmaniasis. Morphology, 2 forms are available. A mastigote, just oval and measure 2.5 microns by 1 to 3 microns, and promastigote flagellated forms. So there are 2 forms. The life cycle is like the organism is transmitted by the bite of several species of bird-feeding sandflies or phlebotomus, which carry the promastigote in the anterior gut. This thing is similar to malarial parasite. Like in malarial parasite, the parasite develops in the gut of the mosquito. Here this happens in the gut of the sandfly. Okay. When sandfly sucks blood from infected hosts, it ingests macrophages containing A mastigotes. After the mastigote in the gut, they multiply and migrate. This thing is similar to what happens in the gut of the malarial parasite. Only the terminology is different, and the area and the cells involved, they are different. Okay, A mastigote, and they develop, multiply, and migrate to pharynx and proboscis, where they are transmitted to the next bite. In human, shortly after sandfly bites the human, promastigotes are engulfed by macrophages, where they transform into a mastigote. Here, the important thing in the human being is that once they are inside the macrophages, the lysosome is inhibited to fuse with the macrophage to destroy this parasite. They are unable, the lysosomes are unable to fuse with the macrophage and destroy the parasite. So the macrophage will be, at some point, will be filled with these amastigote form until the packing of the amastigote will rupture the cell and they will be released and they will infect other macrophage all over the body. The infected cells die and release progeny amastigote that infect other macrophages. We did that. So you can see the amastigote forms inside the macrophages, and this form will be found in the gut of the sandfly. Promastigotes are not found in human tissue. This stage occurs in the midgut of sandfly. Here is the life cycle. So we start with the life cycle in the human being. After the sandfly bites the human being, the macrophages, and they transform into amastigotes. And once the cell is full of all these amastigotes, the cell ruptures and amastigotes are released into various tissues. Okay, when they are present in the bloodstream of the patient, infected patient, the sandfly, which is hungry of blood, because this female fly has to mature their eggs, so it takes the blood meal from the human being, and first there is ingestion of parasitized cells. They transform into this promastigote, which is a flagellated form. You can see it's a flagellated form having a nucleus and a kinetoplast, and they migrate to proboscis, and then they take the blood meal and again infect. So this we discussed, the parasite. This we have discussed. Amastigotes of Leishmania are spherical to ovoid and measure 1 to 5 microns, and they are 1 to 2 micron wide, 1 to 5 micron long and 1 to 2 micron wide. They possess a nucleus, prominent kinetoplast, and a short axoneme, the last of which is rarely visible by light microscopy, and the organism reside in the macrophage of the host. So you can compare these two forms, amastigote form, which is found in the human being, and promastigote form, which is found in the gut of the sandfly. Okay, so here you can find this nucleus, kinetoplast, thickly stained dark color body, and then axoneme, basal body and tail-like structure axoneme. And here, in promastigote form, you find the flagellum here, okay, which is this kind of axoneme or tail-like structure, nucleus, and elongated body. Here it is oval to round type of body. You can see the difference. The release organism infect other cells. The sandfly acquires the organism during the blood meal. The amastigote transform a promastigote and multiply in the gut until the anterior gut and pharynx are packed. Dogs and rodents are common reservoir. Pathogenesis in visceral leishmaniasis. RE stands for reticuloendothelial system. And when we say reticuloendothelial system, It includes liver, it includes spleen and bone marrow. And all of these three organs, they are severely affected by this infection: liver, spleen, and bone marrow. And you will find there will be enlargement of liver and spleen. Okay. Reduced bone marrow activity is cellular destruction in the spleen, because all the cells that are infected, they are sequestered in the spleen. So, and there will be destruction of RBC and destruction of platelets. So there is anemia, leukopenia, and thrombocytopenia. Each one of these mean that there is decreased number of RBCs, there is decreased number of WBCs, all of them, they decrease. And thrombocytopenia is decreased number of platelets. So when there is decreased number of RBC and there is decreased number of WBC, there are more chances of secondary infection. More chances of secondary infection. And if there is decreased number of thrombocytopenia or platelets are low in number, then there is tendency to bleed. And because of the sequestered cells, they will accumulate in the spleen becomes enlarged. Picture, we will find the number of hemoglobin is decreased, number of cells RBC is decreased. G and IgM, they are elevated, but they don't have diagnostic value as such. Okay. Visceral leishmaniasis, they are rapidly eliminated from the site of infection, as there is rarely a local lesion, although minute papules have been described in children. They are localized and multiply in the mononuclear phagocytic cells of the spleen, liver, lymph nodes, bone marrow. So what you will find in a infected patient, you will see there is, because of the enlargement of the spleen and liver, there is protruded belly of the child or whoever is infected. There is temperature or fever, bleeding tendencies, blackening of the skin, dark and ashen skin, cough, weakness, and substantial weight loss. Again, you can see the A mastigote form in the tissues here. In Leishmania tropica, A mastigote form from the skin touch preparation. You can see inside the macrophage, the A mastigote forms are seen here. A mastigotes are being freed from rupturing macrophage. This is the cell here, the cell and the A mastigote forms are being released here. And they can be cultured on triple N medium in the laboratory, which is Novi, McNeil, Nicole medium, because these were the scientists that devised that culture medium, or they put the appropriate amount of everything that is favorable for the growth of Leishmania. Example of visceral leishmaniasis, there's a splenomegaly, distended abdomen, extreme weight loss you can see, and enlargement of a spleen you can see from here. Cutaneous leishmaniasis or oriental, from wherever they were first diagnosed or detected, they named it after the place, like ulcer in Baghdad boil. In cutaneous leishmaniasis, the organism is Leishmania tropica. It multiplies locally, producing papule and after 1 to 3 weeks after the bite. The papule gradually grows to form relatively painless ulcer. The center of the ulcer encrusts while the satellite papule develop at the periphery. The ulcer heals in 2 to 10 months, even if untreated, but leaves disfiguring scar. The disease may disseminate in cases of depressed immune function. When the immune system is depressed, then even the minute infection will spread quickly and take over. So it starts like a single papule, and then satellite nodules or papules, they are formed, and after healing, this will appear. Mucocutaneous leishmaniasis. Okay, lesion involve the mucous membrane, cartilage, and skin in mucocutaneous leishmaniasis. Usually, this occurs at the junction of nose and mouth, like that. And after they heal, they leave a disfiguring scar. Okay, lesion is usually followed by secondary infection. Common in Brazil and Central America. The organism was Braziliensis leishmaniasis, which causes the mucocutaneous leishmaniasis. The organism can facial and nasal tissue and lead to their destruction and hence severe deformity. How we can diagnose such cases? Through the history, symptoms, isolation of the organism from the lesion, aspirate or biopsy, by direct examination of the culture, a skin test, detection of anti-leishmanial antibodies by immunofluorescence. These are the methods through which we can detect. Clinical feature: intermittent fever, weakness, weight loss, massive enlargement. In visceral, there is massive enlargement of the spleen. Okay. So promesticote is shown in a diagrammatic way. Nucleus, kinetoplast, flagellum. Treatment and control. Sodium stibogluconate is the drug of choice, and then there are other alternative also, pentamidine, isethionate. Control measures should avoid from the bite of that sandfly. Vector control is very important. And now we have to topic, that is cysticercosis. Cystisercosis is Cysticercosis. But here the eggs, you have read or gone through that when in pork eating countries, when they eat infected pork, who has got access to the human got with Cysticercosis, and this organism or parasite goes into the muscle of the pig, and that infected pork is eaten. It was developing in the intestine. But here the case of this is different. When a person's eggs in food or water contaminated with human feces, this infection occurs. Egg hatch in small intestine, and the oncosphere burrow through the wall into the blood vessel. They disseminate and go to the brain. They develop to they cause the pressure symptom and a space occupying lesion, and in eye sometime it is observed floating in the vitreous of the eye. Okay, Life cycle, human is the definitive host, pig is the intermediate host, egg is ingested by the pig, hexacanth embryo emerges from each egg, embryo burrow through the blood vessel and carried to skeletal muscle, they develop in cysticercosis in the muscle. This is the usual cycle. But we have done. This cycle we have done. But when I'm talking about cysticercosis, it is the when human being accidentally ingests food or water containing the eggs of Taeniosolium, they burrow through the blood vessel, and then they can go to the skin, they can go to the brain here, or they can go to eyes. Cysticercosis may develop in any organ, being more common in subcutaneous tissue as well as in the brain and eyes. They develop there and cause space occupying lesion here or in the eyes or in the skin. Okay. The adult vomitor, this in the brain, they cause a space occupying lesion. When die, they release substances that invoke inflammation and calcification. Cysticercosis is surrounded by fibrous they are encapsulated except in eye and in the ventricles in the brain. Okay. Cysticercosis in brain symptoms are due to the dead and calcified larva. When brain is involved, the patient will present with fits, vertigo, seizures, anything, or epilepsy type presentation. Okay. And if it is involving the eye, there will be blurring of vision and iritis and blindness. So these are the, you can take the screenshot. These are the research paper and WHO research about the distribution of the the parasite all over the world. So these are the two, and of course your review of medical microbiology, chapter 52 and chapter 54. You have to go through them to see the life cycle and how they present, what is the pathogenesis which is involved, and how these symptoms appear, what are the symptoms, how we can diagnose it in the laboratory and treat it. Now I am open for the questions. So if there are any questions, please write down in your chat box. Yes? Hello?
यस मैडम, कुछ बोल रही है?
जी मैं ये कह रही हूँ कि इनको चैट बॉक्स को जरा खोल दें ताकि वो क्वेश्चन पूछ सके। कितना टाइम है हमारे पास?
मैम अभी है 10 मिनट्स।
10 मिनट्स है ना, तो आप क्वेश्चंस के लिए चैट के लिए अलाउ कर दें।
ओके मैम।
जी जी। Why does spleen destroy RBC and platelets if only macrophages are invaded by the parasite? Okay, this is question by Siddharth. Okay, Siddharth. What happens, any cells which are broken, which are infected, or there is something abnormal about it? As you must have like gone through the various things that these foreign particles, bodies, parasites, infections, they are taken up by neutrophils and macrophages. So once they are like infected, they are sequestered. It is the filtering mechanism. The defective things, they are sequestered in the spleen. Okay, so that's why this is happening. Why promastigote only invade macrophages and feed from them? So it's there. Every parasite, as I was telling in my last lecture, every parasite or a living creature, they have got their preference. Okay. This was question by Zehra Anas. Why promastigate only invade macrophages and feed from them? So they have got their preference for macrophages. That's why. But they are involving other cells also, as I told you, the neutrophils and the RBC, they are also destroyed, which result into anemia and thrombocytopenia also. So it's only not the macrophages. Madam, how much cases? This is Moise. Madam, how much cases of Leishmaniasis have you identified in your practice? I've seen quite a few, but not many. Not many. But this research was done by Dr. Shaheen in DIMC. This research was done. So maybe she is able to answer this question. But I haven't seen many. But yes, any other questions? Are you clear about what you are being told in this lecture? How things are going on? What is the life cycle? What are the two forms? How they infect the cells? How they are being cleared from the body? All of these things? Okay. Okay. So your time is done. Now I will ask you questions. Tell me how many forms of Leishmania are there and or types of Leishmaniasis. Okay, write down the names, whatever name you remember. Visceral Leishmaniasis. Okay, Siddharth is answering. Cutaneous Leishmaniasis, mucocutaneous. Now tell me, what is the difference between visceral, cutaneous and mucocutaneous? What is the difference? Zahra has answered me. 4 types. And Siddharth is telling me visceral, cutaneous. Yes, Leishmania tropica, Leishmania mexicana, and which is the type which is responsible for mucocutaneous Leishmaniasis? Yes, I'm waiting. Brasiliensis. Very good. Leishmania brasiliensis. Okay. Okay. Aksa. Thank you, Aksa. And Maha brasiliensis. Yes. Very good. So, what sort of diagnosis or diagnostic methods you will apply for such a case if you are suspecting that this person is suffering from Kala Azar or visceral leishmaniasis, what you do or suggest to that patient? What are the diagnostic methods for diagnosing these infections? Blood culture. Who's telling me? Sidrat. No, beta, not blood culture. And the Sayyida Samrasha, is that right? The pronunciation correct? Biopsy of the lesion culture. Better. Muiz. Touch preparation. Usually what we do, usually the most prevalent method, culture is on NNN, that is triple N, Nicole and other McNeil and other Novell. These were the scientists who devised the culture method. Touch preparation of the Muiz Tariq. Yes, you are right. The most preferred method is bone marrow like examination, but others are like little more invasive, like lymph node biopsy, spleen biopsies. They are more like invasive method. So we prefer the bone marrow, but all three then can be used, like touch preparation of bone marrow, spleen, and any lesion which is present in the skin. We can do that touch preparation and see the yes, you are right. होमवर्क करके आए हैं आप. That's very good. CBC, बेटे CBC से पता चलेगा, मगर आप डायग्नोस्टिक चीज तक पहुंच नहीं पाओगे. आपको मिलेगा अनीमिया, मिलेगा आपको थ्रोम्बोसाइटोपिनिया, मिलेगा आपको ल्यूकोपीनिया, मिलेगा. यूजुअली जो है ये लाइफ थ्रेटनिंग नहीं है, मगर अगर इम्यूनो कॉम्प्रोमाइज्ड है पेशेंट, then it will lead to secondary infection and then eventually death of the person. अगर वो इतनी वीकनेस उसको हो गई है, इतना वेट लॉस हो गया है, सेकेंडरी इन्फेक्शन बहुत सारा हो गया है, then there are chances that the patient can die from those secondary infections. Any more questions from your side? मैंने आपको बताया ना, सिदरत मुझसे पूछ रही हैं वाई बोन मैरो बायोप्सी इज प्रेफर्ड. मैंने आपको बताया कि स्प्लीन, लिम्फ नोड थोड़े और इन्वेजिव हैं. बोन मैरो में ये है कि आपने बोन मैरो एस्पिरेशन किया, फिर उन स्लाइड्स को हम स्टेन कर लेते हैं और देख लेते हैं कि एएमएसटी गोट फॉर्म मिल गया है या नहीं मिला है. ये जो बाकी स्प्लीन बायोप्सी वगैरह, दे आर लाइक मोर इन्वेजिव, और वैसे ही पेशेंट इमेसिएटेड है, वैसे ही पेशेंट कॉम्प्रोमाइज्ड है, फिर आप उसको ये सारी चीजें. मगर अगर के हम नहीं कंफर्म कर पाए उससे भी, एंड थिंग्स आर इन फेवर ऑफ दिस डिजीज, देन वी विल डू इट. मगर ऐसे होता नहीं है. अगर है तो ब्लड बोन मैरो पे आपको नजर आ जाएगा यूजुअली. ठीक है. Now we will meet on Tuesday. So until then, मेरा ख्याल है अब हम लॉग ऑफ होते हैं. ठीक है, ठीक है बेटा. मैं देख नहीं पाती, आपके रिएक्शंस देख नहीं पाती. You can tell me. That is okay. Thank you बेटा, thank you. जी शारिक.
यस मैडम, अस्सलाम वालेकुम.
जी अस्सलाम वालेकुम. जी लॉग ऑफ कर दें, हो गया हमारा.
ओके मैडम, अस्सलाम वालेकुम.